Welcome to Neurology. This week, we'll take a look at the intercostal nerves, the lumbar plexus, and the sacral plexus. In this lesson, we're going to focus on the anatomy of the intercostal nerves and the anatomy of the lumbar plexus. Let's take a look at the intercostal nerves first. So the intercostal nerves, you can call the thoracic nerves. And what's interesting about them is they do not form a plexus. We know from our previous lesson that a plexus in Latin is a braiding. You could think of it as a mesh or a network. That doesn't happen here. Each intercostal nerve or thoracic nerve runs in the costal groove of each rib. So on the underside of each rib, if you remember, there's a shallow groove known as the costal groove. The nerve runs right inside there. So we can see here posterior view of the thorax with thoracic vertebrae, and then we can see here the thoracic nerves running. And take a look, they're running right on the underside of the rib, again in that costal groove. Now, our thoracic or intercostal nerves, they branch into both anterior and posterior rami. Let's take a look at the anterior rami first. The anterior rami pass anteriorly in the intercostal space. So all I'm saying is they go to the front of the chest and they're going to supply the skin and the anterior and lateral chest muscles. The posterior rami are going to go to the back of the body, right? They're going to go posteriorly in the intercostal space, supplying the skin and the posterior trunk muscles. The intercostal nerves directly innervate the structures they supply in the intercostal spaces. So, for example, the T3 spinal nerves are located between the third and the fourth ribs, and they supply them, and it supplies the muscle and the skin at that level, right? So it's very localized. So here's a table that shows the anterior rami as well as the posterior rami as far as what they're innervating. Let's do the anterior rami first. The T1 intercostal nerve has both motor and sensory. The motor is going to be to the intercostal muscles of the first intercostal space, and it's going to do sensory to the skin, again, overlying that first intercostal space. The T2 intercostal nerve has motor to the intercostal muscles of the second intercostal space, but it's going to do sensory to the skin of the axilla and the posterior medial arm. Right, so this one's going down into the upper limb. T3 through T6. Right, the motor, the intercostal muscles at their respective levels, so that's nice and easy, and sensory to the skin of the anterior and lateral chest, again, at their respective levels. T7 to T12, the motor is going to be to the intercostal muscles as we would expect. However, they are also going to innervate the muscles of the abdomen. Sensory is going to be to the skin of the lower thorax as well as the upper abdomen. And so all of this was the anterior branches, the anterior rami. The posterior rami, these we could do as a group, T1 to T12. They're going to innervate as far as motor, the muscles that move the trunk. For instance, erector spinae, multifidus, semispinalis, and then all of the segmental muscles like the interspinalis muscles, intertransversarii muscles, right? They're all considered segmental. And then the sensory is going to be to the skin of the posterior trunk. And that is our intercostal nerves. Let's move now to the lumbar plexus. So the lumbar plexus originates from the anterior rami of L1 to L4. The plexus passes obliquely outward and posterior, right? And they actually emerge between the psoas major and the QL, the quadratus lumborum. Let me show you a picture real quick. So here's the QL back here. Here is the psoas major, and you can see the nerves emerging from between those two muscles and then heading down into the the pelvic area and into the upper lower extremity. And generally, the lumbar plexus supplies the anterior lateral abdominal wall, the external genitalia, and going down into the lower limb. Right? Again, we can see it emerging right between the QL, quadratus lumborum, and the psoas major. So we'll take a look at four nerves first: the iliohypogastric, ilioinguinal, the genitofemoral, and then the lateral femoral cutaneous nerve. The names tell you generally where they go, so it's not too hard to understand or to just kind of remember. For instance, the iliohypogastric. This one comes from the root L1, and it's going to do muscles or motor to the muscles of the anterior lateral abdominal wall, and it's going to do sensory to the skin of the inferior abdomen, but it does go down around to the back and innervates the buttock area. Right, so sensory to the skin of the inferior abdomen and the buttock. That's the iliohypogastric. Coming out at the same level is the ilioinguinal. This is going to do motor to the muscles of the anterior lateral abdominal wall, just like the iliohypogastric, but sensory is going to be to the skin of the superior and medial aspect of the thigh, so it is going into the lower limb, the root of the penis and the scrotum in the male, and the labia majora and the mons pubis in the female. The genitofemoral nerve is going to come from L1 and L2. Now, motor is to the cremaster muscle. This is a muscle in the male that will help to elevate the testes and descend the testes based on temperature, as well as during sexual function. So this is a muscle that is unique to the male. As far as sensory, it supplies the skin over the middle anterior surface of the thigh, the scrotum in the male, and the labia majora in the female. That was the genitofemoral. And then the last nerve for this group will be the lateral femoral cutaneous nerve. This comes from L2, L3, and this is just the sensory nerve. It doesn't go to any muscles. And it's going to supply the skin over the lateral, anterior, and posterior aspects of the thigh. Now, this nerve does have a pathology which is known as neuralgia paresthetica. This is an entrapment of the lateral femoral cutaneous nerve, and it causes pain, numbness, and burning in the distribution of the nerve, that anterior, lateral, and posterior aspect of the thigh. Sometimes even just wearing, tight jeans, that type of thing can cause it. Pregnancy, there's a number of things that can cause neuralgia paresthetica. We'll talk about different nervous conditions later in the semester. So here are the four nerves, right? The iliohypogastric, you can see, is coming from the anterior division of L1. Ilioinguinal, also the anterior division of L1. The genitofemoral, right here, anterior division, L2. And then here's that lateral femoral cutaneous nerve right over here coming from L2, L3. So let's take a look at each nerve individually. The first one I have for you is the iliohypogastric, just following along with that chart. So we can see the nerve right here kind of coming down, right? Iliohypogastric. And the iliohypogastric is going to do, as I said before, the muscles of the anterior lateral abdominal wall. Two of the muscles that it innervates is the internal abdominal oblique muscle, which we can see right over here. You can see the fibers running up and down this way. And then just deep to that is the transversus abdominis, right? So the internal abdominal oblique muscle here, and then the transversus abdominis. The internal abdominal oblique causes ipsilateral rotation of the trunk, and the transversus abdominis doesn't really move the trunk, but it will compress the abdomen, tighten the abdomen. Right? We sometimes call this muscle the corset muscle, and it just kind of contracts and squeezes in the abdomen, kind of like suck it in type of thing. All right, so that's the iliohypogastric nerve. Again, we can see it right here. innervating the internal abdominal oblique and the transversus abdominis. The second nerve was the the second nerve was the ilioinguinal nerve. So again, inguinal, as you can tell, it's running right by the inguinal ligament, which is right about over here, and it's going to head over to the genitalia. You can see it kind of heading right over this way. This one will do went the wrong way, sorry. This one will, as far as muscles, will do the internal abdominal oblique, which we saw before for the iliohypogastric nerve. And again, like I said before, it's going to do sensory to the root of the penis and the scrotum in the male, the labia majora and the mons pubis in the female. And then this one does head down into the thigh, into the upper medial aspect of the thigh. So this is called the ilioinguinal nerve. The third nerve I have for you is the genitofemoral nerve. This does innervate the cremaster, as I had mentioned, in the male, which is important for just regulating the temperature of the testes. For instance, if the temperature was cold outside, the cremaster muscle would contract, bringing the testicle closer to the pelvis. If it was warmer, the cremaster muscle would relax and the testes would descend. During sexual function, during ejaculation, the testes need to be up against the pelvic floor. The cremaster muscle will bring bring the testes up to the pelvic floor. All right, this muscle from a sensory point of view uh, does the skin, as we said before, over the middle anterior surface of the thigh, the scrotum in the male, and the labia majora in the female. So again, you can kind of see it coming down right to the genitalia area. The last nerve in this section is the lateral femoral cutaneous nerve. As I mentioned before, this is just a cutaneous nerve. It doesn't innervate any muscles whatsoever, and it's going to do the scan over the lateral, anterior, and even the posterior aspects of the thigh. And this is the nerve that can become entrapped. And cause neuralgia paresthetica. Even from a massage therapy point of view, this muscle can become entrapped under the sartorius, wearing again tight jeans, somebody having pregnancy, sometimes as the abdomen gets bigger, or obesity that can compress the lateral femoral cutaneous nerve, causing the neuralgia paresthetica. Okay, the last two nerves of the lumbar plexus are the femoral and the obturator nerves. The femoral nerve comes from nerve roots L2, L3, L4, and this is going to supply, from a motor point of view, the flexor muscles of the hip joint, as well as the extensor muscles of the knee. So it's basically going into the anterior um, pelvic area and thigh area. As far as sensory, it supplies the skin over the anterior and medial aspect of the thigh, and it goes down the medial aspect of the leg all the way down into the foot. The last nerve of this group that we'll do is the obturator nerve. This also comes from L2 to L4, and this is going to hit your adductor muscles of the joint. So all the muscles of your, I'm sorry, adductor muscles of the hip joint. This is going to hit all the muscles on the medial thigh. And then from sensory, it supplies the skin over that same area, the medial aspect of the thigh. And you can see these are the lower nerves down over here, the femoral nerve and the obturator nerve. There is an accessory obturator you can see only present in about 10% of the population. We didn't include that in the chart. We're going to focus just on the femoral and the obturator nerve. So the femoral nerve, as I said before, just from a general point of view, does the muscles or the flexor muscles of the hip joint, as well as the extensors of the knee. So we can see it right here, coming from L2, L3, L4, right, coming down right through the pelvis and then heading down into the anterior aspect of the thigh. Let's take a look at some of the muscles. So we can see up here the iliacus, right? This is a flexor of the thigh. This goes from the iliac fossa right into the lower to the lesser trochanter, and then when it contracts, it will flex the hip. Then we have the quadricep muscles. We have the rectus femoris, The three vastus muscles, vastus medius, intermedius, and the lateralis. So here's our vastus medius right here. Here's the rectus femoris right here. And then here's the vastus lateralis right here. Now, underneath the rectus femoris, I didn't include it in the image, but right underneath the rectus femoris would be the vastus intermedius. All three of the, I'll take it back, all four of those muscles extend the knee, right? They're going to do knee extension, but the rectus femoris, in addition, since it crosses the hip joint, will do flexion of the hip. Okay, so iliacus, and then your quads, vastus medius, rectus femoris, vastus lateralis, and again, not shown under here is the vastus intermedius. The other muscle that is innervated by the femoral nerve is the longest muscle in the body, right? This is called the sartorius or the Taylor's muscle, sartorius. This muscle will do flexion of the hip joint, lateral rotation of the hip joint, as well as abduction of the hip joint. And then at the knee, it will do flexion of the knee and then medial rotation of the leg, right? The tibia and the fibula. Right, that's the sartorius. So all of these muscles are getting this nerve right here, the femoral nerve. Okay, and that brings us to the last nerve of this lesson. That's the obturator nerve, right? This nerve you can see actually goes through the obturator foramen, hence the name. So you can see it also comes from L2, L3, L4 through the pelvis. And then you can see now, look at this. It's not going over to the femur. It's kind of heading to the inside of the thigh where it's going to hit our five adductor muscles. Adductor magnus, adductor longus, the brevis, gracilis, and the pectineus. So on this picture here, I have the kind of the big, deeper muscle. This is the adductor magnus. Look how big this thing is, right? This fills up most of the inside of our thigh, and obviously this whole group is going to do adduction. Um, I have it here. This is also the gracilis I have over here. We can catch a little bit of that. Excuse me. Here is the remaining adductor muscles with the adductor magnus removed. So we're catching right here the gracilis, right? This is the adductor longus. This is the adductor brevis. And then over here, this is going to be the pectineus. Again, all of these muscles are going to do adduction of the thigh. Okay, and that concludes this lesson on the intercostal nerves, the 12 intercostal nerves, and the lumbar plexus.